Mr. Miller,
Here.
Ms. Stevens,
Present.
we have a quorum.
Madam Clerk, is anyone signed in for public comment?
No, no one has signed in.
Okay. Approval of the minutes from the April 17th, 2019 meeting. Can I have a motion?
So moved.
Moved and seconded. All in favor, say aye.
Aye.
Meeting minutes have been approved. One item here today referred to the committee, and then we have two presentations, as you can see on your agenda. So if you can read the first item into the record, please.
Resolution number 2019-0127, making awards on requisition number 42974 to various providers for the Propel Cuyahoga Workforce Services Program for the period 7/1/2019 to 6/30/2020.
Thank you. And who is here to discuss? Or to present?
Good afternoon, David Merriman, Assistant Director of Health and Human Services. I'm here on behalf of the department, including Job and Family Services, as well as the Department of Health and Human Services, to present this item to you today. Very excited to be here and to be sharing with you the awards from a long and very extensive process. I'm going to be joined, if necessary, by Bob Math from our Contract Administration and Performance Unit, or Kevin Gowan from Job and Family Services, if needed. We also have both of the awardees represented here today. So if you have questions for any of them, we're all here to answer whatever questions you have. I also do understand that there are several presentations to come on the agenda, so we'll try to be to the point if possible. As this committee is well aware, we manage the TANF, SNAP, and at times other levy-funded workforce services. These services are critical to the community because they help residents that are living in poverty gain access to services that will address their barriers and give them a path to a career. This has been something we've been doing for many years. We've come before you on many occasions to present contracts, either amendments or new contracts for job search, job readiness, or the work experience program, or screening and assessment. And I think these were all very good programs. The services were helpful to residents, and I think they had an impact. But what we have acknowledged is that those services can help the resident, but they can do more. And so we designed this RFP to do that. And we are excited to bring forward the two awardees that responded, that are presenting, I think, an approach that takes advantage of the strengths of the services that were already being provided, but also offers new opportunities. The RFP itself that we released this year was developed by the Department of Health and Human Services, Contract Administration and Performance, and JFS. And what I'd like you to know is that we sought and utilized the input of direct service staff so that this RFP is not just responsive to the overarching program requirements, but is responsive to the experiences of the staff that are using the services. And I think that's something that we're really proud of. And in getting the input of direct service staff that will be managing the program, we also invited them to help score the proposals. So we had over 38 individuals scoring this proposal. Some are the eligibility specialists that are doing the referrals. Some are their supervisors. We had United Way. We had a foundation come and join us. And then we had administration and contract management staff. So this was, to me, an exhaustive review because we included the input of a variety of functional perspectives. And we also opened the process up to get some external validation. We've done that in the past, but we thought this was a valuable time for us to get some of that external validation of what we were trying to accomplish. We got 8 proposals in response to the RFP. The RFP was written to allow an applicant to apply to be, in essence, a single comprehensive provider where they offer all the services, or to come forward and to provide those services, but to also have subcontractors. And we have both of those. And so before you is a recommendation of award to Maximus, who has many partners, but is principally going to be providing the services, as well as the centers, and El Barrio, who will be the prime provider, but has a number of subcontractors as well. And what is exciting to me about this is these are two well-established organizations. Both have contracts for many of these services in this community right now. But they're going to be leveraging, again, what they already know how to do, but then doing much more. So what does that mean? So in the past, if you will recall, when a person came in to receive cash or food assistance, they would generally get an assessment by an eligibility staff. The cash assistant recipients would go and there would be a subsequent assessment, and then they would be assigned to a worker who, looking at their needs, it would develop essentially a case plan, an individual service plan of one form or another, depending on what program they were coming through. And then they would start to make referrals to different providers. So it was conceivable that a resident coming through the door could talk to 5 or 6 different providers at different locations in the first 2 months. And that experience could continue throughout that resident's time with us. So, and this was necessary because each of those programs provided a different component of service. And ultimately, those components were critical because they helped us maintain compliance with the federal government. The federal government has very strict rules about eligibility and expects that at least 50% of the participants in these programs are compliant. They are doing the hours and activities they need to do to be able to receive benefits. That does not go away with this proposal here. We will still first and foremost prioritize compliance. We will not allow the county to get in any sort of position where we're at risk for being out of compliance and the need for corrective action. But we felt that's the start. And after we establish that as a priority, we also need these services to really help the residents explore careers, explore jobs that are in careers that have real wage growth and the opportunity to achieve many of the benefits that we all know are essential for a family. Health insurance, paid time off, career growth. So this service that we're proposing will achieve compliance, but will also help residents explore careers that are meaningful for them and for the community. And lastly, we've written into this that we expect that service to be equally beneficial to the business community, to our employers that are still having a difficult time finding employees. So we want this program to be able to equally serve the residents, but also the community need. And the community need is tied to both resident and business and many of the larger structures within here, within the community. So in essence, this new approach, we believe, will allow us to continue to serve residents with all of the programs that we have been offering all along, such as job search, job readiness, and placement, such as individual training accounts and the work experience program. But instead of having those services each being provided by a separate provider, Maximus and the centers will be doing all of those services in-house and through their own partnerships. And that way, when a person comes to us and they need job search, job readiness, they can be served by that provider. If they need another service, they stay within that initial referral. We'll be holding these awardees accountable to achieve compliance, but also to respond to the individual's needs. And as those needs develop and change over time, they have to have the services that will match both the requirements, but also the goal of the individual. A last thing that I would say on this point. So certain elements of the service we pay they invoice us and we pay for their costs, but we've also committed to performance-based contracting. So we do have incentives in this contract for placement at wages above minimum wage, for retention, and we've introduced through this process for attainment of education and training and credentials. We believe that as much as, ultimately we're judged by our funders on having 50% of our participants be in a compliant activity, we feel like this project should in part be judged by, are we able to move these residents into jobs that those jobs pay a better than minimum wage and that they have career potential and that they're offered training and education. And over time, we're going to begin to layer on that to start to check in with our businesses. Are these referrals leading to potential clients? So we feel there's a lot of growth potential through this award and alignment of services. while at the same time still achieving the programmatic compliance which is required of us. So that's a lot of information. I'd like to just take a break and see if you have questions about any of the components that I've described.
Yes, Dave. I think you glossed over my first question, which was what was changed from the previous way that we dealt with these contracts. Could you provide to the committee a list of the subcontractors that will be under Maximus and the centers?
I can provide that. I think I can describe it here. I believe there's a subcontract with Verge, L&E and Associates.
Is that under Maximus?
No, that's under the centers. I don't believe Maximus has a direct subcontract as it relates to the services.
Okay.
I'll check in and we'll confirm that. But the centers is working with Verge. It's working with Towards Employment, Tri-C and Catholic Charities. So this is interesting because this is more of a network approach, leveraging many of the resources that were offered by other providers. And I would acknowledge many of those providers applied independently as well as a part of this contract, which I thought was, a reasonable action.
Verge, Towards Employment, Catholic Charities, and what was the last one?
Tri-C.
Thank you.
Was L&E, was that?
L&E. Yeah, the L&E is also referred to as Verge. They're I think formally their legal name may still be L&E, but it's Verge is the name of the
Verge
organization.
do for these dollars?
So Verge is a current provider for Job and Family Services. They have been one of our providers for many years. They offer residents job search, job readiness, and placement services, case management, and then they do follow up once the resident has been placed.
And in the past, you used to independently contract with each of these providers, correct?
That's correct.
Okay.
I should recognize we still also have a contract with Catholic Charities that is not included as a part of today's proposal. Catholic Charities does a universal assessment and screening for people coming to us for cash assistance. And this assessment, it looks at what are the barriers that they're going to have to the programs, but ultimately to employment. So this is not the entire inventory of our services. This is the service component when we make referrals.
I thought Catholic Charities, that you were weeding that out in terms of the assessment. When you had spoke before in front of us about
Yeah.
YOU or the workforce, I thought you said that was phasing out.
Actually, thank you for bringing that up. I should have said, so this service will principally serve people that are older than 25. There is a separate approach that has been developed by the state of Ohio, which is for individuals that are 14 to 24. They utilize the services of the Comprehensive Case Management and Employment Program. Most people call it CCMEP. And that CCMEP program, we did recently present to the Education Committee. And that program, there's a integration of TANF and WIOA dollars. And we have, in a very similar way, in fact, the RFP that we used for this procurement, much of it was used for the CCMEP procurement. So we'll have consistency. But along those same lines, we also saw that several of those proposals included sort of a prime provider as well as subcontractors. And so CCMEP will serve cash assistant recipients that are younger than 24. This program will serve cash assistance recipients that are older than 24.
And please help the committee out with what that acronym stands for.
Sure. So it's Comprehensive Case Management and Employment Program.
Okay.
And when the state designed this, there was an effort to braid together the TANF, Temporary Aid to Needy Families funds, with the WIOA, or Workforce Innovation and Opportunity Act funds. So the funds come to us in a single pot. In the past, we broke the funds apart, and TANF was managed by us, and WIOA was managed by OMJ. Now we manage them together. We had a common RFP, common set of contracts, and we'll do common contract management, common performance measurements as well.
So it's more efficient.
We believe so. And we hope ultimately that this efficiency will, one, allow us to prioritize more resources for things like training, but we'll also have less burden, administrative burden on the departments or the agencies, so that they're not doing separate sets of performance reports, They're not preparing for separate site visits. And, and ultimately, we're seeing a level of collaboration that we're pretty proud of.
And this RFP is just for a year, or are
So-
you doing?
Yes, the initial proposed timeframe is for a year. There will be option years included. I believe it's 3 option years.
Open it up to questions.
Questions?
Councilwoman Brown? Miller, and then Stevens.
Thank you, Madam Chair. So you touched on the in-demand occupations. Can you describe the industry or some of those type of occupations that we're talking about here?
Yes. So, Councilwoman Brown, I think you're absolutely right in phrasing it as in demand. We recognized in this RFP that all of our services need to track the needs of businesses, and so looking at each of the proposals, we did look at whether or not they were bringing with them existing partnerships. I think a component of competition, where we release RFPs and we fund a lot of different agencies and then expect them to find job placement opportunities, you tend to have many agencies going to major employers. And there's an element of competition then where agencies are saying, well, I can offer this, and others saying I can offer that. So what we saw in this is, so a good example is one of the center's subcontracts is with Towards Employment. Towards Employment has a strategic relationship with University Hospital. And so they have this Step Up to UH program where Towards Employment does essentially a soft skills preparation for residents. And then UH gives them a more fast track hiring because they've gone through and they've vetted and they've prepared them. And then UH hires them at an entry level and then presents a career path for them to move up, quite frankly, all the way to a nurse, becoming a bachelor in nursing. So that's one example. Other providers that are included, the Catholic Charities has different relationships. They presented, having experience doing community health work. I don't know if that will be a specific relationship that establishes here. Verge presented having direct relationships with many small employers. Some of them are fast food organizations or retail establishments, and some of them are larger employers. And I think our experience in this is that we need to have a broad selection of employers. It's great to have university hospitals and some of the marquee businesses in this community, but it's also important to have small nonprofits because small for-profit businesses, because many of those are in communities, and you can address transportation barriers by placing somebody in their own neighborhood. And we're also hearing from many small businesses that we're not sending enough applicants their way. So we're going to spread this out, and we're going to have large relationships and many small relationships to really track how those are performing.
Okay, thank you. It leads me to my next question. You touched on the client relationships with the service providers and how they will assist them on their career path. Is there an expected time frame in which they are required to work with the clients?
So for context purposes, Ohio policy and Ohio law is more restrictive than the national requirement. When we receive these TANF funds as a state, the state has said that residents that are on TANF cash assistance can only get cash assistance for 36 months in their lifetime. The national law is 5 years or 60 months. So in a way, we have a max of 36 months to help these residents. I'll share what my response to that has been in the past. It's not enough time. I would recognize when CCMEP was developed, they asked for my input as well as other JFS directors. And we said, we think this is probably more like a 5-year relationship with ups and downs, with improvement and sometimes regression. But the law is 36 months. So at most we have 36 months to work with these families. And some families come in and utilize that full 36 months. But many don't. Many come to us when they're pregnant or they're in the postpartum period and they can't work. And this becomes almost like a maternity leave. And then once that postnatal period is over, they go back to work. And so different residents come to us with different expectations and goals. And so sometimes our service may only be 4 or 5 months, but sometimes it could be 36 months. I would say we're generally designing around the longer engagement simply because if somebody comes to us and they utilize all of their months, we better get it right because they can't come back. And what we would say, in the past, in pursuit of compliance, some of our clients would come to us and we would refer them to, I'll use an example, a nonprofit that would enable them to do their work experience program. I think there's a lot of value in that. The resident could get exposed to a professional environment, learn soft skills, but if they don't actually get a hard credential, if they don't get an education or a training experience, they potentially could leave no better off than when they came in, other than those experiences. So for us, it's really looking at how are you doing the most for the resident during that time that they want services. And the most can't be you're just helping them maintain compliance. We need to see skill growth. We need to see exposure to industries that can hire and want to hire and need to hire. We need to see, placement in those industries that lead to progressive wage growth. So that's how we're going to be looking at this service.
Okay. If I understood you correctly, there's now TANF dollars and WIOA dollars that come together?
I think I probably have confused things. Okay. The TANF and the WIOA is just for the youth program.
Okay.
That is just for the youth program. We presented on that 2 weeks ago, I think, when there was the question about YOU and some of the other providers. What I'm presenting to you today is TANF.
Strictly TANF.
And just to a smaller extent, there are some levy dollars here. There's also some SNAP, some supplemental nutrition assistance, employment and training dollars that are also included in this. And so this is some mostly TANF, some SNAP, and then a little bit of levy dollars.
It looks like 100% TANF. So if you go double check and verify that. The other question I had with the combination of service providers, did the contract collectively go up, stay the same, or was it reduced? Are you able to determine that?
So we were contracting for, I think, more than $7 million in the past. So I'll confirm the actual figure of what we spent in the past year and what we'll spend out of the next year. I don't want to do just an off the cuff answer to that.
Okay, thank you very much. Thank you, Madam Chair.
Councilman Miller.
Thanks, Madam Chair. And to Mr. Merriman, who are the other 6 that applied for this?
So Catholic Charities applied independently. Verge applied independently. Luther Metro Ministry applied independently. Thank you. Spanish American and Results America. Is that the other one? I'm sorry, there was another organization we had. America Works is the last.
You said Spanish American and what was?
America Works.
Okay, so I have Catholic Charities, Verge, Lutheran Metro, Spanish American, and America Works. That's 5.
And Towards Employment.
Okay. So.
They applied independently as well.
And did you generally find consistency in the scoring that you did internal with your external sources that you used?
I think there was a lot of internal consistency across the reviewers. Each proposal was reviewed by 2 sets of teams. And so you essentially had 2 groups looking at the same proposal. And there was, to me, it was a remarkable amount of consistency across both teams. And many of those teams included internal and external participants. To answer your question, I don't know if we didn't have enough external that we could say they scored generally different than the internal reviewers.
And what kind of activities constitute compliance?
Sure. So the law stipulates the activities, and we included those in the RFP. And there's a range, but I guess how I'd answer is I describe what we've done, what we're doing right now. And so a person coming in asking to get helped find a job immediately, we can offer them job readiness, job search, and job placement services. Here's the caveat. You can do that for 4 weeks, and then you have to take a minimum of 2 weeks off, and then you can offer it for 2 more weeks, but then you can't offer it for the rest of the year. Yeah. So job search, job readiness can be offered for 6 weeks in a year, And 4 weeks can be sequential, then you have to take 2 weeks off, and then you can do it 2 more weeks, and that's it for the rest of the year. So that's one activity, and it's an important activity because it does help us address a lot of the soft skills that people need, as well as do some of the career exploration. And for someone who's just looking for the assistance with developing resume or finding job leads, that's job search, job readiness, job placement. Another service that can be provided through this is a vocational education, an individual training account. That service, you can actually do that service for 12 months, but that's it in the lifetime of your participation. So hypothetical, a parent comes to us and says, I want to get a bachelor's in nursing degree because I understand that's a growing industry. We say yes. That program will count for your first 12 months of activities. After that, you still owe us 20 or 30 hours a week. And you can use job search, job readiness for a part of that, but that's not how you can do it the most of your time. So vocational education is a core service, and the 12 months allows us to do a little more programming around short-term credentialed programs that are less than, I'm sorry, did I say 12 weeks? It's 12 months, 12 months. And, but there are limits on vocational education and how much you can use it. So really what you're left with as the principal service and the principal activity is the work experience program, which is unpaid work. That's a service you can do for the entire time that you're in this program. And, so let me finish that thought. So that's something you can do the entire time, and depending upon the age of your children, a resident will need to provide 20 or 30 hours a week. And I would just recognize WEP is the easiest way for us to achieve compliance, because once you make the referral and they establish the schedule, transportation and childcare, they're going to a site most likely in their community and volunteering. It's unpaid work for 20 to 30 hours a week. And this is where I would say that is valuable to the resident, to that organization, but I still question, have they learned a skill, or have they developed some specific credential or skill that they're going to take out when they're done with us? I do want to step back one bit. As I described the funding for this program, I said most of this is TANF. I do think there is some SNAP dollars in this, and SNAP has a little more flexibility, but I'm providing you the overall for TANF because TANF is the vast majority of the resources here.
And are Maximus and Centers for Families and Children essentially providing the same set of services, or are there differences between what they're providing?
Essentially the same set of services.
And why are they funded at different amounts?
We responded to the proposal they submitted. We negotiated the budgets. Their proposals may be different than what you see on the paper, but when we initially released this RFP, we released for a 20-month grant period. We needed a little more time to do the review, so we came back with a 12-month, but we responded to their proposals and then negotiations ensued.
How many people are there in Cuyahoga County that are unemployed and who have exhausted their lifetime benefits?
Councilman, I don't know if I can answer that question. I don't know the figure about how many people have exhausted their benefits.
What do we try to do for those people?
It's a great question. So I've looked at some of the reports around the implementation of welfare reform. When welfare reform was implemented, we had around 25,000 families receiving assistance. Some of those families may have been where a family member is caring for a child, and that child-only benefit is not included here. When a family gets cash because they're caring for a niece or a nephew or a grandchild, they don't have the same work requirements, and so we don't refer them for this program. This program is for the families that get cash and have the work requirement. But so when welfare reform was implemented and we had 25,000 families and we started to have the 36-month lifetime limit unless there's a hardship, we started to see a significant decrease in the number of families we were serving. And I would say point in time, at any given time right now, we might have around 1,000 families receiving assistance. And so the vast majority have left. I don't think we saw the same drop-off for SNAP, for food assistance, and for Medicaid that we saw for TANF. So I can't say that I've seen a report on this, but what I can say is I think our caseloads for SNAP and Medicaid and childcare have been much more stable. They've stayed around the same levels that they were prior to the implementation of welfare reform. And so what I take from that is that many families that were on cash assistance were told you have 36 months, what's your plan? And many went out and got jobs. But I think our concern is that many of those jobs were not going to be at a living wage or at a wage that was going to allow them to really, accrue the assets and the wealth that they need to be stable. And so I think we saw many people working and accessing SNAP because they have to work and because their work doesn't pay for the entirety of their benefits. This is a big part of the reason why we're pushing for more integration with WIOA, because WIOA allows you to serve someone who is working. As soon as if you come into us and you get a job making, 10, 12 bucks an hour, if you have one child, you're going to be ineligible for these services. You'll be at too high of a level of income. WIOA will still serve them. And it's for that reason that we have developed this effort to try to integrate our services with WIOAs, because we know many of the people that go to Ohio Means Jobs have come to us. Sometimes people go to OMJ and they should come to us because we could have a benefit that could be useful for them. So, to answer your question, this is the charge to the workforce system, I would say, to be responsive to people that may have exhausted their TANF or may not want TANF, but want help. And it's our job to figure out how to provide them help that will meet their needs, but also, I would say, employers' needs.
Right now, we're in a time where unemployment is low compared to historical standards. And my question is, does that make things easier because jobs are plentiful and there's also a path to better living wage employment? Or does that make things harder because it's an employer's market and they can afford to be picky, and the people that we're trying to move into the workforce, they might not get chosen. They might choose other people.
I don't know if I could say easier or harder. What I would say is I have talked to employers. I've been on site with employers. And what I'm hearing is they're having a hard time finding candidates for their open jobs. And there are two reasons for that. Some, they just need the volume, but some, they need skilled employees. They need people coming through the door that certainly have the soft skills, the required behaviors to be successful at work, but more frequently, they want them to have a specific trade, skill, experience, credential. And so I'd say there are two issues there. I think some of what we need to be doing is to be directing these residents to the employers that need employees, but are also, they're good employers. At some point, we have to recognize that, some employers out of the gate offer their employees benefits. They offer them a certain amount of flexibility. And if you're a parent with a young child, if you're a single parent, they may offer things that other employers do not, and we should be responsive to that. So I'd also say the economy what I've heard is that the economy has employers taking risks on employees they may not have in the past. And so for me, this is the perfect time for us to be implementing this program that says, employers, we want to respond to your needs as well. This isn't about us just meeting compliance. That's important, but you need a pipeline of talent, and we have thousands of people we serve every year. How can they meet your needs? And we think we can be responsive. I would say, in this room, both the centers and Maximus, on occasions that, Department of Development has gotten outreach from an employer, can you help us find people? Both of the providers behind me have helped us find candidates to be considered by employers for open jobs. And so we're doing this. I think we can be successful in this. I think we have to do it more and a higher scale.
And finally, just a comment that I think having lead agencies provide the full range of service is just a big step forward. It it just is gonna help the beneficiaries with the navigation tremendously, and allow for sustained efforts to be done over time that hopefully will not only move people into employment, but get them on a successful career path that's going to lead to living wage employment.
Thank you for that. I agree with you. I think what our residents need is a relationship they can trust, someone they can go to with their issues. I would recognize that when we send a client to 4 or 5 different providers, they probably tell their story 4 or 5 times. I don't know about you. I don't want to have to tell my story 4 or 5 times, especially if I've lived through trauma, especially if I'm not excited with how it's going right now. So sending someone to a lead provider lets them develop that relationship, and it hopefully gives them a little more trust, because they don't have to keep repeating themselves. This is who I am. This is what I want to do. Now that provider is charged. You have to meet compliance, but how are you going to help that client? And and if you do better than others, we'll do incentives. We will recognize that.
Stevens.
Thank you. You talked about the term of service, the maximum term of service being 36 months. What's the typical term of service?
I can't answer that. Let me go back. I'll get an answer for you on that, because I think we do see people that complete the full 36 months.
But what are we on average doing for?
Let me do some analysis on that. And I should also recognize people can apply for a hardship. So there are residents that get more than 36 months, but they have to present some compelling cause. And I know some of that is people that are preparing for maybe an SSI filing, or they're preparing for some other major decision in their life. So there are families that get more than 36 months. It's not the norm.
What's an example of a job that gives, what was the phrase you used, progressive wage growth?
So, the partner that I feel very proud of is University Hospitals. They have stepped up. They have said, we need 500 patient care reps. Can you send us 500 referrals? And if you'll send them to us, they don't need to have a training. They don't need to have a credential. We will provide that to them. And if they do well in that program, we'll expose them to career opportunities, becoming a phlebotomist. You can go from I was just at a meeting and they were talking about, the patient care rep may make $9, $10 an hour, although I know some of the institutions are looking at having a minimum wage that's much higher than that. But phlebotomist may be $1 or $2 hour over that, and that's a 6-week credential, if I'm remembering correctly. And so that's, if you can start out at entry and then you can get to phlebotomy, can you then get to becoming an LPN? Or can you get to the next level? And then ultimately, can we find enough people that want to explore a career in healthcare that will allow them to become an RN? And then, then you're talking a serious livable wage. And so University Hospitals, they're doing this. For our summer youth employment program, it's our county internship program, they're our #1 placement site for 18 to 24-year-olds. They want us to send them residents that want to explore a career in nursing. And they're hiring them above minimum wage. And if that's what they want to do, and some of them it's not, after they do the exploration, they walk away. But if it's what they want to do, I'm pretty confident that UH and other major providers will offer them training and education and career growth, partially out of a sense of civic self-responsibility, but they need it. They need nurses. That's what we're hearing. These institutions need talent, and they're sourcing. This is a strategy to source talent, bring people in at entry level, skill them up to become, the real mid-level talent that they need.
Those were my questions, Madam Chair.
Councilwoman Brown.
Thank
then
you.
Joan.
You talked about the 2 teams. Were you referring to DCFS and JFS when you talked about the combining the services now being more efficient?
Yeah, I'm not sure. So there were multiple teams that were included in this, and some were the administrative staff that are out of the Department of Health and Human Services, Contract Administration, and the other shared service departments. And then there are job and family service staff that are doing the direct service work. And we brought those 2 groups together to be the internal team. And so we had a mix of the professional staff that work for Bob Math that do this, but then that professional staff were also training and supporting direct service staff to do the evaluations because we wanted their input.
So they don't have any interaction with the client, if you will, just the providers, the service providers?
No, I'm sorry, they do have interaction with the client, significant interaction. So once the client completes their assessments and generally speaking, get assigned childcare, because folks have to have childcare before they start the program, otherwise they're not going to show up. Then they meet with an eligibility specialist, and this is a direct service staff person, and that person is going to be making the referral to one of these two providers. Some of what they might be looking for is, did you get served by one of them in the past?
Right.
If that worked, you're going to go back there. If it didn't work, we want to know why, because we have another option for you.
So what I guess what I'm trying to, or hoping for at the very least, is that the clients, as you indicated, don't have to repeat their story. So do they have one point of contact by virtue of this contract and services?
Yes. So while they're in services, if there's no break in that service, they have ongoing contact with that direct service worker, the eligibility specialist, and then they will also be working with a staff person within the provider. So they will have 2 points of contact. The direct service worker at Job and Family Service has an extremely difficult job, in my opinion. We have to ask that client, what do you want to do? What are your goals? What are your skills? Are there barriers? And okay, so here's where we're going to refer you, but when it doesn't work out, we also then have to take action and at times sanction the resident. So that's, that relationship is difficult, and in many situations, the relationship does include sanctions. So there's value to have our direct service staff engaging with the client, hearing from them so they can make a good referral. There's also value for that client to have a relationship at a provider that doesn't have the same sanction requirement. Now, if a client stops showing or if they're not ready for the service, that provider is going to report to us and we're going to take action. We have to do
Primarily,
that.
that's my
Yes.
question is
Yes.
within our organization, within the county, there is one point of contact.
That's right.
Okay.
Yeah,
And
they are
then-
assigned to work. And I'm sorry, I think I have your question. So we moved to a case banking model that allows us to do eligibility management for people applying for SNAP, applying for Medicaid. They don't have a designated caseworker anymore. This program still has caseworkers.
Okay. All right. And then finally, I want to just revisit the 12-month period and obtaining some type of certification or vocational degree. That clearly is not enough time. So is that a federal requirement?
It is.
Okay.
It
So
is.
there's nothing we can really do to.
I don't think there is. I'm told there are strategies being considered that use like work study, and so there may be some path through it, some workarounds.
Okay.
But I would tell you that prior governor submitted a waiver request to the federal government asking to do away with that restriction, because I think it was generally recognized that a person going to school, that should be their only activity. You shouldn't have to owe us volunteer time.
Right.
That's your activity. Do that and do that alone. Get it done. Because if you get your degree or you get your education, you're going to be doing better. And unfortunately, the federal government never responded to their waiver request. I should also recognize one other point on that. A resident that comes to us and doesn't have a high school equivalency, that doesn't count. Looking at a GED, doing Aspire, doing one of those programs, that doesn't count as the core activity. We can have you do some of it to do some non-core time, but you're still going to probably owe us 20 hours a week, which doesn't make sense.
Jones?
Who had the contract before this one?
So Maximus and Centers both had contracts with us, and they've had for several years. Verge also had a contract with us. They are subcontracting with the centers. And Catholic Charities still has a contract with us.
Okay.
I should also recognize Ohio Means Jobs gets some of our TANF funds, so that when we want somebody to do a short-term credential program, we refer them to Ohio Means Jobs and they can get an ITA out of that. We don't have a lot of success.
Was the size of the contract across all those providers roughly $7 million like this one?
It was a question that was asked earlier. I want to give a precise answer. I'll take it back. I'll get what we spent for these services in 2018 and what we're proposing for 2019.
How many individuals were we able to touch or help in the previous contract, and what is your expectation for this contract?
I think it's around 2,000 a year. Is that about right? Yeah, I think it's around 2,000 are served in a year, but there's really only about 1,000 on the cases at any given time. So people come on and off, and sometimes they come on multiple times. So an unduplicated count is probably between 2,000 and 3,000 in a year.
Are you able to give a percentage of those 2,000, how many actually go on to find a true career path, and of those 2,000 in UH or wherever they might?
Not right now, not a career path. I think that's been a part of the issue here, is that you know, achieving a career path is not a stated goal of TANF. Helping people achieve self-sufficiency is. And obviously the real bind here is as soon as you get any entry-level job, you're probably going to be pushed off TANF, and we're going to lose the ability to track you. Part of what we want to look at is, can we get unemployment data in the future so we can begin to track people after they leave us? So we're talking about how we can access unemployment data and how we can start to track this over time.
Really, the goal, to use your term, you said self-sufficiency.
Yeah.
Become employed but just be self-sufficient, if not a genuine career path. To that, of the 2,000 individuals, could you identify how many reach self-sufficiency?
I don't know if I could say that what percent are self-sufficient. There was an evaluation done by CASE about 10 years ago, and what they found is that when people completed the program and you know, they used up their time and they got good services, many of them went on to get employed, to gain employment and maintain employment to some level. When people stopped with us because we sanctioned them, it's probably because something else was going on in their life. And when they ended with us on sanction, there's a good chance they actually didn't go on to get self-sufficiency.
So you sort of lose contact with them after that? There's a point where you have lost contact?
There's a component of this that is sanction compliance. When someone is sanctioned, we do want to maintain contact with them. If they come back to us, we want to start services up and support them. But generally speaking, when we lose a person, unless they're still getting SNAP or Medicaid, we no longer kind of providing them this service. We can't. Once they use up their time, or once they're at an income level that they're ineligible for cash, we're no longer going to serve them.
So if we're looking for self-sufficiency and employing, what is our workforce percentage, workforce participation rate?
It's probably right around 50 right now. Could be a couple points below, a couple points above. We've been hovering around that. There's a little bit of, there's been some instability in our data system that we implemented from the state. For much of the year, there was some reporting problems. This isn't our one we developed locally. So I can find out what it is for the most recent report period. I think it's going to be accurate because I think we've worked through the bugs at the state level, but I can get for you what the work participation was for last month.
Last month. And what is the state requirement or minimum requirement?
It's 50%.
It is 50%. Okay.
50% of participants have to be doing those activities at full hours. So let's just recognize, if you give us 19 hours 1 month, unless you've got some cause, you didn't meet it, and you owe us the full hours. And so somebody that gets 80% is still failing. You need to get us 100% of your hours.
Okay.
And we do accept good cause. I should recognize that parents can report good cause for missing, but there are limits in the number of hours that they can report, and there's a time frame for that.
When you mentioned children, are the recipients here only ABODs, able-bodied individuals, or?
No, the vast majority of these are pregnant or parenting families. Most of them are single-parent families. So most of these are single mothers, or they're women that are pregnant. We have some two-parent households, but it's a fraction of, it's maybe 10%, or maybe a little bit less of the entire body.
You mentioned, although it says 100% TANF dollars, you say there's a small portion of SNAP dollars in here.
Yeah, I'm going to confirm that. I had understood that was the case, but I think I was corrected to hear this. I was corrected that this is presented as just TANF. So I may be inaccurate with that. Let me go back and confirm what the breakdown is.
What are the total dollars of TANF? What are our total dollars, and what percentage of this is this of that total amount?
Yeah, I'll find out what our current allocation is. I don't want to report it right now because there's some fluctuation in it. Sometimes we get some increases. Sometimes we get, year-to-year variation in how much money we're getting. But let me find out what our current allocation is with all adjustments.
I'd like to know what that is, the total amount, TANF dollars. You have a rough guess of what percentage $7 million is of that?
Thinking 30%? 30% of our TANF?
It's a good chunk.
So probably higher than 30% of our allocation.
30% to this.
Yeah.
How would you characterize the effectiveness of this, of the $7 million? Have we been accomplishing? Do you feel satisfied with how?
It's a sad statement. We're not in the cycles of heavy corrective action that we were in the past. And, I don't like to be defined by that, but at the same time, we live in this environment now that there's a lot of focus on work requirements and people in public assistance doing what they are required to do. So I just have to recognize that's a priority, and it's not what we'd want to be defined by, but it's our job, and we're gonna always ensure that we're achieving work requirements and that percentage. Beyond that, I think our providers do a good job right now, and I think sometimes they do a great job. But what I don't know is if that's, what that means to the client, when the client has to go to multiple locations and they have to go through multiple provider relationships, and that provider is just charged with doing a slice of the activity that needs to occur, that I think a lot of times they'll figure out how to do more than that. But, when they're given the full responsibility, I think we're going to see them do a better job. I think there is room for improvement. And my hope is that as more residents see people they know do better through this program, we're going to start to see more people asking for assistance. I think we also have to recognize, as was brought up, the economy's better right now. So I think that could play a role in the number of people that are getting benefits. When the economy isn't doing as well, we could see more people asking for benefits. I think that's the case. And I think when that comes, it'll be great to have more training and quality services to offer them.
Thank you.
My follow-up to that is, my concern, Dave, is how they plan or will determine what each sub, the Maximus and the centers, how they will plan what each subcontractor will receive. Before I know we had a specific way that we did things, so could you elaborate on that, how they plan on making sure it's equitable?
So, I'd love to invite the centers up to talk about how they manage their process. I know they went through a process planning with the subs, and they developed budgets, and then they had to make some changes. So how about if I ask the centers to come up and introduce themselves to respond to your question? Would that be okay?
Okay, and then my second part to that question was also the other agencies. My two reservations is one, the first one that I stated, and other agencies' opportunities to bid, because American Works, first time that I heard of them. So for this county, we did a procurement and contracting whole thing about fairness and allowing people to be able to contract and have other agencies. I get the efficiency here, I get it. But I'm just wondering if those are my two concerns. Did we look at that and really outweigh, and who was America Works? So we could talk sideline about
Okay.
America Works and,
I'll follow up with you directly on that.
yeah, most of the others are, proven, they've been in it, but we don't want to stifle offering, opportunities for other agencies.
Well, and I'll just say this was a unique time, because at the same time that we were releasing this procurement, Ohio Means Jobs was releasing its adult procurement and its youth procurement with us. So I would say there's a lot of opportunity this year for agencies to bring forward proposals. And
But
most of
those
the
proposals are going to go through these two agencies. They're
not
not
all
going
of
to
them.
come.
Some of them went through OM&J, either with us or without us. And I could say there's some providers that we're not funding that OMJ is funding, but by integrating with them, I think we can begin to leverage those relationships. Let me have the centers describe their process for how they develop their network approach, and just provide any other detail they'd like on that. If you could introduce yourself and what role you're at the agency.
Hello, Councilwoman, Council. My name is Barbara Andelman. I'm the Vice President of Workforce at the centers.
And Melissa Rossanello, I'm the Director of El Barrio.
Your question pertained to the fairness of the contracts with our subcontractors. I'm going to have Melissa go into greater detail, but the process has been extremely collaborative. We've sat around the table for many hours with our partners to fine tune the journey and the path that the client will take to successful completion and family sustainability. And so as we've fine tuned how that program is going to look, that's affected the different services that each of us together are going to provide to ensure that the person has a seamless path. And a client we're in this together in terms of we're all going to succeed on the contract if a client is successful, and we'll all feel the pain if a client isn't successful. So this is extremely collaborative in terms of each of us contributing the portion of the contract that our activities comprise, and sharing equally to ensure that we are all contributing 110% to the success of each client.
So when we came together, we decided to look a lot at our strengths and what did, what did each of us do well. And then when the contract came together, as far as the budgets were concerned, each of us came together with what did we each need individually for our budgets to do our services well, and then where could we combine some services so that we had efficiencies as well across all of us. And so that was the primary goal when we came together with the budgets. And then as far as how do we earn, because this is part performance and it's part reimbursement. For the performance part, because we're all doing such very different activities and they are weighed a little bit differently, and the way that we would have been paid in the past is a little new to us, we decided that the fairest thing across all of us was, again, to either succeed together or fail together. So it is broken up across all of us proportionately to what our original budgets were. And then as we earn the dollars, we will pay each partner proportionately so that all of us, again, will either earn all of our dollars together, or if there's some adjustment that needs to be made, we will have to figure out how to adjust our individual budgets or fill those gaps together as well. And we've been working very collaboratively and closely to make sure that, because none of us want to be in a position where we're concerned about how we're going to meet our budgets at the end of the year. So we are working very closely to make sure that each of the parts that we are doing are, again, being supported by each of us, and we're talking consistently and regularly. And every part of our program, literally, no client's going to come to us and feel like they're in a different provider. That we are going to have what we've called navigators, and those navigators are going to be with that person from start to finish. And that's a really important part of what we're going to do. So as they go through these activities, as you learn that there's these really tight expectation hours that people can or cannot do, and as they move through those activities, we want them to feel like they're progressing and with one provider. So that's pretty much how we came together. And also because we're doing that, it's really hard to decide who did better than somebody else when someone gets a job, right? Because we all contributed to that.
Okay, and just quickly, very quickly, because we have two presentations. Oversight, how do you plan on doing your oversight for each of those subcontractors?
So we are a couple things. We have a new system that we're going to put into place. It's an electronic system so that we can manage our numbers. We will all be reporting into the system, and we will be meeting weekly to look at all those numbers to see where we all are, where any gaps might be, and to be sure that we can follow the client from the time they start with us throughout the program, and we'll be looking at those numbers on a weekly basis.
And how much does that electronic system cost?
We don't have the final.
Yeah, we're still talking with different providers. The centers is bearing the greater share of that, but there's a small line item in the
And will
budget.
Maximus, since they're a different contract, will they be able to
No,
benefit
this
for
would just
that
be for
elect?
them.
Oh, okay. So I'll have more questions with you offline, because I've got to move on. So,
Can I just say in
Yes.
closing, first, I want to just recognize that this coming together, this has been a long process to develop this RFP. I want to thank Kevin Gowan and Paul Bounds. I mean, they came in and this thing was in the middle of it. I mean, I think Paul's first month, and we were already reviewing proposals. And then Paul jumped in as the deputy over this, and had to immediately get up to speed and start scoring. And their team. I think at the end of the day, part of what I'm really excited about is how much engagement we had with the direct service staff to ask their opinion, to get their advice, and to train them to do this. Many of them are asking for, how do I move up in the organization? Well, this is a big part of it. Learning to manage providers is a big part of it. And I want to salute the eligibility specialists and their supervisors that gave us the time and really committed the energy to get this done. Same to be said for Dan Humphrey, who's working with us on this. I think this has been an enormous team effort. And, I think this is the start, but over time, you're going to see this thing develop into something that I believe will exceed expectations.
Okay, thank you. Can we have a motion to move this to the full council for second reading? Moved and seconded. All in favor, say aye. Aye. Okay,
Thank you very much.
so would I speak to Kevin or you offline about this?
I'd love, you can speak to all of us, any of us at any time you want. And so, but I would ask you to first direct questions to Kevin, because his team will be tactical with this. And I'll continue to support Kevin. I'll also get the information that you requested today that I didn't have answers for.
What's Kevin's full name?
I'm sorry, Kevin Gowan.
Gowan.
Kevin, if you could stand. So this is Administrator of Job and Family Services.
GOWAN.
Yes. Yes. Yeah, we'll distribute contact information and cards.
All right, thank you. And if we can have our first presenter come up, Ashley?
Got it, thank you. Good afternoon.
Good afternoon.
Thank you, Chairwoman Conwell and Vice Chair Jones and members of the Health and Human Services and Aging Committee. I'm grateful for the opportunity to be with you today to talk about the role that Cleveland Rape Crisis Center plays in our county. So I'm Sandra Miller, and I'm the president and CEO of Cleveland Rape Crisis Center. I work every day to fulfill our vision, which is the complete eradication of sexual violence. I stand on the shoulders of a 29-member board of directors and 80 full-time professional staff, and at any given time, about 100 volunteers who are working on the front lines 24/7, 365 to support our mission, which is to support survivors of rape and sexual abuse, to promote healing and prevention, and to advocate for social change. So 1974, it was a small group of volunteers that recognized the need for a rape crisis program and wanted to create a safe place for survivors of rape and sexual abuse to find help. Cleveland was one of the first 10 cities in our nation to start such a program, and today we are home to the largest independent rape crisis center in the nation. Over time, over the last few decades, we have expanded services to include justice system advocacy, counseling, support groups, community education, prevention, and training for first responding professionals. We're the only local agency providing comprehensive intervention and prevention services. So earlier this year, just a few months ago, we celebrated the 45th anniversary of the very first phone call that came into our rape crisis and support hotline. And since then, we have answered more than 125,000 calls, and now also we include texts and online chats in that statistic. We also have started in the last few years a second hotline providing specialized response to survivors in our local community who are trapped in commercial sex trafficking. Last year, more than 10,000 survivors of rape, sexual abuse, and sex trafficking accessed our services in 19 locations in 4 counties across Northeast Ohio. And an additional 55,000 people benefited from our education and youth prevention and professional training programs. So if you see on the map, 16 of our locations are located within Cuyahoga County. Later this summer, we are pretty excited to be opening our 17th location on Shaker Square. So stay tuned for some more information about that. You might also notice that some of the locations where we provide services are directly inside some of our county agencies. And I'm going to say a little bit more about that those collaborations in a moment. So research from the Centers for Disease Control and Prevention tells us that 1 in 5 women who live in Ohio and 1 in 71 men will be raped in their lifetime. We know that children, yes, CDC research, 1 in 5 women who live in Ohio and 1 in 71 men who live in Ohio will be raped in their lifetime. We know that children are disproportionately impacted by sexual violence, as are people of color, those who live in poverty, those who identify as LGBTQ, or those who live with a physical or mental disability. More than 80% of our total clients, those who walked through our doors last year, reside in Cuyahoga County. I think it's worth noting that clients of Cleveland Rape Crisis Center come from every single zip code in our county. While some populations and subgroups in our county are at a higher risk for sexual assault, we know that every sliver of our community is impacted by this issue. Women, men, children, every age, race, religion, economic status, neighborhood, and more is impacted by the epidemic of sexual violence. And about 50% of the clients who walked through our door last year reside within the city of Cleveland. So how do we help those who come to us for support? You can see we offer a full range of services. A few of them I'll highlight for you today. I think first and foremost, where our advocates are on the front line, is our Rape Crisis and Support Hotline. On average, each and every day, we respond to 19 calls, texts, or chats. That amounts to about 7,000 each year. So just as a point of reference, when I joined the center just 10 years ago, we averaged 8 calls per day. So in the last decade, we've gone from an average of 8 per day to 19 per day. Our role on the hotline, if you're calling, you're texting, you're chatting, our role is to provide support, answer questions, connect to resources. Hospitals, so nurses and emergency departments, and law enforcement officers also call our hotline when they would like us to send an advocate to meet with a survivor face-to-face. So what you see on TV perhaps, or you hear if a survivor goes to the emergency department and gets a sexual assault evidence collection kit, or sometimes called a rape kit, our advocates are available 24/7 to be in the room with the survivor and the nurse to provide support. Our advocates also support survivors as they're navigating the entire criminal justice system. So from the hospital exam to filing the police report to being interviewed by an investigator or meeting with the prosecutor, going to grand juries, sitting through court proceedings, all the way through, perhaps even an offender being sentenced or an offender being released from prison. We provide support through that entire process. Our job is emotional support. Our job is to help them understand the process, what to expect, and support them as they make decisions for themselves. The number one question that our advocates answer is, why is this taking so long? Well, in the past 3 years, requests for our victim advocacy services have more than tripled. And while we see the increase in demand for victim advocacy services, the majority of people who call or walk through the doors of Cleveland Rape Crisis Center are not involved in any criminal justice proceedings. The overwhelming majority of our clients were raped or abused years, if not decades ago, and either never told anyone, or if they did tell, they were not believed or supported, or heard things like, this can bring shame upon our family, we're never going to talk about this again. In the shadows of the Me Too movement and an unprecedented volume of national, regional, local news headlines about rape, sexual harassment, sexual abuse, human trafficking, survivors of these crimes are finding the courage to speak out like never before. And that has meant that more people than ever before are calling or walking through our doors. I think what our experience has been responding to those survivors, it's been twofold. We have definitely heard from survivors who feel very inspired by what they are hearing and seeing in our community and across the nation and across the world. We are also hearing from survivors who are very triggered by some of the headlines, the very high profile cases, and just general conversation about Me Too. Rape is the most underreported crime in the nation, with 2 out of every 3 incidents never being reported to formal authorities like police or children's welfare agencies. I think that's important when we think about what are the needs of our county residents. We tend to think our response as a community and society is often criminal justice, which is important for a percentage of survivors. But the overwhelming majority are not pursuing offender accountability, but they do need the emotional and psychological support to recover from a trauma. There are a lot of reasons why survivors choose not to report. We hear a very, very long list of reasons, but the number one reason that they choose not to report is fear. Sometimes that is fear of retaliation from a perpetrator. Sometimes it is fear or just distrust of law enforcement or criminal justice professionals in general. Sometimes it is fear about who's going to find out, how quickly are people going to find out, is the whole world going to know that this happened to me, and sort of losing control of who knows what. But the biggest reason, and the one that is still really startling to us, is they are afraid they will not be believed by the people that they choose to tell. Our team of trauma therapists support survivors as they're making decisions about whether to file a police report or not, tell a parent or not, whatever the actions may be or the choices that may be in front of them. And we support survivors no matter how long ago they were hurt. We know that even the very simple act of picking up the phone or walking through our doors for counseling or for a support group, it sends a message that you are not alone. It takes incredible courage for people to make that phone call. The first phone call or the first time someone's walking through, it's the hardest step. And I honor all the people who find the courage to make that choice. We are really grateful at Cleveland Rape Crisis Center for every single person that trusts us with some really personal care. Sexual violence impacts survivors in a lot of ways that can lead to long-term physical or mental health implications. I mean, these are issues that I'm sure you hear on this committee, you hear about them all the time. Survivors are 3 times more likely to suffer from depression, 4 times more likely to contemplate suicide, 26 times more likely to abuse drugs. And a common thing that we hear from many of our clients, he didn't kill me, but I'm dead on the inside. We know that the impact on survivors is tremendous, and we also know that the impact doesn't start there. Sexual violence impacts survivors' families, it impacts their friends, it impacts their coworkers, and it impacts our community as a whole. And I don't ever want to minimize the physical and the psychological harm that it causes, but I think it's also important for you as policymakers to understand there's also an economic cost to survivors and to society. So the Center for Disease Control estimates that the lifetime cost per victim of rape is $122,000, and that accounts for short and long-term physical and mental health treatment, lost work productivity, criminal justice proceedings, property loss and damage. And I know that listening to someone talk about rape and sexual abuse can feel a little dismal and can be a little bit of a downer. So I want to let you know that while these are really tough issues and have pretty serious consequences for our community, I am here today with a positive message, and I hope what you take away from my participation here today is a sense of hope for our future. We know that while there's a huge toll for survivors and their support systems in the community, the toll can be significantly reduced when survivors are met with first responders who understand trauma and understand sexual violence, and that simply just start by believing the survivor's experience. The toll can also be reduced when survivors have access to healing services, some of which are found at Cleveland Rape Crisis Center. I believe wholeheartedly that sexual violence can be prevented. And our prevention specialists at the center teach evidence-based programs to students throughout the county. We talk about things like healthy relationships, healthy boundaries. What do you do how do you intervene if you see something that may not be safe or may at least look suspicious? And all of these things help us to prevent this from happening in the first place. And here's where I find the hope to get up and do this work every single day. When I talk with young people who are a part of our programs, I can tell you that they have absolutely no tolerance to keep quiet about things like rape and violence and abuse. They are not afraid to stand up and speak out about injustice. And they don't care if the adults that are around them might be a little uncomfortable. Our vision to eradicate sexual violence, it's ambitious, to say the least. We know that Cleveland Rape Crisis Center, all by ourselves, we will never achieve this vision. We need an army of people, of organizations, of institutions that are working in partnership to shift our culture, to create a climate that supports survivors, and ultimately prevent sexual violence from happening. Collaboration is a key component in our work, and I'm proud to highlight just a few of the county agencies where we either partner to provide services, or in some cases, some of our staff are embedded inside county agencies. We have a victim advocate who works full-time inside the County Department of Children and Family Services. We have another employee that works inside the County Sheriff's Office, specifically on the Northeast Ohio Human Trafficking Task Force. We have an advocate that works full-time at County Juvenile Court. We provide a lot of services in cooperation, of course, with the prosecutor's office. We work closely with the Witness Victim Service Center and specifically the Family Justice Center. We have a presence with a lot of the local hospitals, including, of course, Metro Health. And we are also the facilitators for the Cuyahoga County Sexual Assault Response Team, which is a group of multidisciplinary professionals all the way from law enforcement, Department of Developmental Disabilities, all of us who are working together to try to improve our community's response. Our work would not be possible without collaborations from these agencies and others, and without funding from the Ohio Attorney General's office and from private philanthropy. We share a common goal, I'm sure, I believe, with each of you. We want every person who has been impacted by rape or sexual abuse to recover and to heal and to thrive as a member of our county and our community. So I thank you for inviting me here to talk about the work that we do, and I'm happy to answer any questions that you may have.
Any questions? Councilman Miller?
I want to thank you for coming in today and sharing with us on this very pressing and important topic in our community. And my first question is, where do you draw the line between sexual harassment and sexual violence?
That's a good question. Our role is to believe and support every survivor who reaches out to us. So it's not always important to us what exactly a survivor's experience is. If they're walking through the door of Cleveland Rape Crisis Center, we provide support to them. Say harassment tends to be less contact involved, maybe perhaps more psychological, more verbal abuse. Sometimes it escalates into physical contact or misconduct or what have you. The partners that we work with, largely criminal justice, are of course following Ohio Revised Code to define those terms.
And we're currently seeing a deterioration of the reproductive choice rights in the country right now. Does this have any impact on the sexual violence environment, and if so, how is it affecting it?
Yes, absolutely. What we know from survivors who have experienced any form of sexual violence, what has happened is their power and their choice has been taken away from them. And an important component of healing is to put that power and that choice back in the survivor's arms. So when we're providing services, to the extent that we can, we are giving survivors every choice possible. Do you want a sexual assault exam or not? Do you want to file a police report or not? Do you want to meet at our office on the east side or the west side? And to the extent that we can let them choose how they want, what they want their process to look like and how they want to heal, we're helping them recover. So the Cleveland Rape Crisis Center is always going to advocate that survivors have as many choices available to them as possible.
Councilwoman Brown.
Thank you, Madam Chairwoman, and thank you again for the work that you do. I think I heard you say that the statistics increase in people of color significantly in the LGBTQ community. Do you have those statistics available?
I don't have the exact figures in front of me. I most certainly can get them. And I want to clarify that just looking at sort of national demographics and who is impacted, whether they are reported or including those that are underreported, those are some of the groups of populations that are at greater risk.
Okay, and I couldn't help but notice on the client served slide that the 44102 area code is the area with the largest, it looks like, number of clients served. I guess my question is, there something, where is that exactly? First and foremost, do you know what part of the Cleveland that is?
Yeah, obviously near west side of Cleveland, it might go into Lakewood. I know 44107 is Lakewood. And why is that darker than all the others? We have looked at that. I don't feel like I have a magic answer. We don't have an office there. Well, take that back. We offer services within May Dugan Center, which is located on the near west side. What we have paid attention to is why the zip codes on the east side, where there are higher numbers of sexual assaults reported to Cleveland police, why we don't have more clients coming from the east side. And that is through a much larger process why we've made the decision to open our next office at Shaker Square.
Okay, and I guess the last question that I would have relative to that is, so how do you identify clients served? Is it where they live or where the rape took place?
And I want to be very clear, this is where clients who walk through our doors, so they received counseling services, attended a support group, victim advocacy services, and this is where they told us that they lived.
Okay.
This is not the same as sexual assaults or sex crimes reported to the city of Cleveland or any other municipality. Those maps are not the same.
Okay, so those are just people who have been raped that come in, and wherever it took place, they just identify where they live.
Where they live,
and you
correct.
and you identify them according to that zip code.
Correct.
Okay.
And this is also who came to us in calendar year 2018. So it doesn't mean that their sexual assault happened in 2018. It means that's when they came to us for services.
Anyone else? Councilwoman Stevens.
Again, I want to thank you for your service to the community. What types of preventive programs are you providing support to? Because if we are to change these numbers, which are still significantly ugly, it means that we have to have programming that teaches not only our youth, but some folks who are middle-aged and middle class how to handle themselves better.
Yeah, that's a great question. So from where our resources are spent in the agency, it's about 90% plus on support services for survivors and a very small percent on prevention. That is not necessarily by our choice. That is resources that are available to us. So how do we begin when we're talking about just a very small part of what we do? It's like boiling the ocean is how we think of it. Where do you start to prevent this? So where we start is generally middle and high school classrooms. We have a curriculum that we use that covers some of the topics that I mentioned. And then we also, outside of that, as requested by the community, we have some girls-only groups and some boys or young men-only groups that are tailored to their needs. The girls' groups tend to be, what happens is while it's presented kind of as a preventative program, we get a lot of disclosures from participants in the group. So it plays a dual role. The program we do with young men was created by a group out of DC called Men Can Stop Rape. And it is a program that looks at how our media, what we see in the media about violence. What does it mean to be a strong man? How can we redefine healthy masculinity? And again, takes an approach of bystander intervention. How can we teach people to safely intervene if they see something that is not okay?
So how many programs, like using this example, how many places is this operated? We have 59 municipal jurisdictions. Are we in at least 40 of them?
No, unfortunately. So I have 3 full-time employees that are prevention specialists doing this work. I would say that we are in probably between 50 and 60 school districts in a year. Not that we reach every student that's in each of those districts. We try to do a lot with a little, and then the gender-specific groups that I mentioned are done. Some of them are done in collaboration with our city rec centers or Boys and Girls Club type environments. Sometimes other community organizations.
Thank you.
Now, every victim doesn't have to, if they come to you, to the Rape Crisis Center, and they haven't went to the cops and they don't want to, do you respect their privacy to do that?
Yeah, that's not our decision to make. Our role is to help survivors understand what their options are and what they might expect, whether they choose A, B, C, or D, and help them talk through those options. But it really is up to them to make a decision that is best for them.
Because I know if they went to the police first, then the state takes over and it's kind of out of their hands at that point to determine which route they want to go.
That can happen, yes.
Okay. So you share that in when you're going to the various classrooms, maybe, I mean, I don't want to dissuade people from going to law because somebody didn't broke the law, but you know what I'm saying? In this specific topic, it gets so personal, even with the rape kits, when we just decided to catch up on the backlogs, it was still the victims were the ones getting kind of punished in a way because they didn't have a voice to say, no, it's done with me, I want to move on. So just wondering how, this is very delicate how we're handling that.
So generally, of course, we want everyone who's hurt to report to law enforcement, and we want every offender who has perpetrated this kind of behavior to be held accountable. But our job at Cleveland Rape Crisis Center is to advocate for the individual survivors, what's in his or her best interest. And we understand that sometimes reporting and going through a criminal justice process is really important part of their healing journey. And we are going to encourage that and support them along the way. I also recognize that sometimes for survivors that cannot be safe, that may not be safe, or it may be detrimental to their mental health. And we also, we're going to be the agency that advocates that should be all right too. Once there is a report made, it's in the hands of law enforcement and other criminal justice entities what happens with that case. I mean, it becomes out of the survivor's control. So we want to make sure that she or he is making that decision with all the information that they need.
Well, I like the way you put it, that it's part of the healing process. And that helps statistically majority of the victims. Or it's not victims, it's, what is it?
Survivors.
Yes. All right, is there any other further questions in terms of this topic? Well, we want to thank you. Thank you both for coming out and sharing. We will try to make this a regular during March, which is Women's Month, to bring awareness to, and that might, since there's so many male survivors now, I don't know, that might be, I'm going to do it March and June or somewhere in between there.
Any time of the year is fine by me.
All right.
Thank you.
Thank you. And if you can call up the Greater Food Bank.
All right, thank you very much. Thank you very much. Well, good afternoon, Councilwoman
afternoon.
Conwell, and to all members of council. It's nice to see you all, and we appreciate very much the opportunity to present to you this afternoon. I'm Krista Morzoka, the President and CEO of the Greater Cleveland Food Bank. I've had the chance to meet many of you and to host you for various volunteer opportunities and tours of the food bank. And I'm happy to be here today with Tiffany Scruggs, our Director of Outreach as well. This is a hard act to follow. Sandra and her team do such extraordinary work. Thank you for all you do in the community. And we're here today to talk about a couple of different things. What's going on at the food bank these days, what we're seeing in terms of the need for food in Cuyahoga County, how we're responding to that, and also a challenge that we've been struggling with and our clients have been struggling with since August related to the state's new benefits management system. So I'll go ahead and get started here. As many of you are aware, the mission of the food bank is to ensure that everyone in our community has access to the nutritious food they need every day. It is an aspirational mission in our statement that we want to make sure that everyone has the food that they need. And the fact is that some days it feels like it's getting harder. We try to do this work in two different ways. One is by addressing the everyday crisis of hunger by providing folks who turn to us and to our nearly 1,000 programs across 6 counties with nutritious food. We also try to address food insecurity in the long run with some newer work around connecting clients to benefits. And when I say newer, I mean newer in the last 6 to 8 years. And more recently, connecting clients to other nonprofit partners who can help them address the root causes of hunger and become more food secure in the long run. I have shared these slides from time to time. And there's some history here, so I'll flip through them to give you a sense. This first map starts in 1999, and it shows poverty data by community. The darkest blue has the highest level of residents at under 200% of poverty. We serve anyone up to 200% of poverty at the Greater Cleveland Food Bank. The dots of various sizes show where we have partner programs that are distributing food in various neighborhoods. And I think that what is most compelling about this slide or maybe most shocking, depending on your perspective, is how it compares to the slides that follow it. So this is 1999. This is 2009, and you can see very clearly that it's the darker blue is moving, right? And the number of dots are more. And this is 2019. The fact is that there are more clients eligible for our services, and there are also more agencies serving them, which has been part of a very conscious effort. And also, there's a lot more need in the inner ring suburbs and other parts of the community than there had been traditionally. When we look at simply kind of the hard data here, this shows the number of people eligible for emergency food assistance from the food bank over that time period. The last column is 2017, because that's the most recent census data that we have available. But you can see that the number of people certainly, so the recession ended in 2009. And unfortunately, the numbers of eligible people are still growing since 2009, which is a real challenge. In 1999, 29% of Cuyahoga County residents were eligible for food from the food bank. In 2017, 36% of Cuyahoga County residents were eligible for food from the food bank. And I am frequently asked why there is growth there in an economy that has improved in some ways at a time when unemployment is so low. And there are two things that we are seeing from our perspective. One is the growing number of seniors. We know based on demographic data, and this is not just Cuyahoga County, this is statewide and nationally, that the number of seniors is skyrocketing and it will continue to grow. Seniors are living longer, They are trying to age at home and they're running out of money and they're turning to the food bank. In some cases, we have seniors who have never, ever needed help before, who are calling our help center when they are out of food. We also are serving people who have gone back to work, but they're working in lower paying jobs. So there was some data that perhaps has been shared with you at a different time from Policy Matters Ohio. They looked at the 10 most popular jobs in the state of Ohio. And when I say popular, those are the jobs with the most people in them. Only one of those 10 occupations paid more than 200% of poverty, and that was nursing. And so, we know when we have folks who come into our programs and also come into our monthly produce distribution at the food bank, that very often we're seeing people in work uniforms. And sometimes they're coming after one job and before their next job. So folks are working very hard, but unfortunately, they are still struggling to make ends meet. And so what are we doing about this? Well, we have been working very hard to increase the number of partner sites that we work with, to provide more nutritious food to more agencies to try to meet this need. You can see that last year in 2018 in Cuyahoga County specifically, we provided access to about 44 million meals. We did that in a variety of different ways. We distributed almost 25 million pounds of free fresh produce and other perishable food. And we served 825 programs in Cuyahoga County specifically. Those are programs ranging from food pantries where a client can go in and get a bag of food to take home, to a hot meal site, to an after-school program that serves low-income children, or a senior program that provides meals to seniors in need. And you can see that last year we served 224,000 unduplicated people in Cuyahoga County. So if I go back, that's out of the 447,000 people who are income eligible. So roughly half. On one hand, we're pleased that we can have such impact and serve so many people. On the other hand, it's only about half of the people who are eligible for our services. I mentioned that we work with program partners throughout our county and our 6-county service area. These are specifically programmatic partners in Cuyahoga County. I know that many of you are familiar with the food pantries in your districts, but we also serve we have mobile pantries, where we take out a truckload of fresh produce to a community partner. Sometimes it is at a bricks and mortar agency. Sometimes we need to get more creative if we don't have a bricks and mortar agency in an underserved community. We do produce distributions in parking lots in some cases, always in partnership with another community organization. We do them at churches, we do them at schools, just about any neighborhood where we know that there is need and not enough access to fresh produce. Our Backpack for Kids program provides meals for children over the weekend when they may not have access to free or reduced price breakfasts and lunches. Those volunteers at the food bank, and we have about 18,000 unduplicated volunteers a year, pack food into bags, which are distributed to partner sites and then distributed in a way that the students can be kept anonymous. In some cases, those are at schools. There is some new programming that started in our last strategic plan, because we've been working very hard to target this growing number of seniors, also children, because we know that food insecurity can be devastating for children and for their long-term growth and development, and also working with healthcare partners. There's more and more data out all the time about the impact of food insecurity on health, on your likelihood to be diagnosed with a chronic disease, and also on your ability to recover from that disease. And so we want to make sure that low-income patients who are struggling with food-related disease have access to the healthy food that they need. Our school markets are essentially a fresh produce distribution at the end of the school day, where children who are leaving for the day, either with a parent, a guardian, a grandparent, or sometimes on their own, by foot or by bus, can take home fresh produce for the entire family. We have 31 sites in Cuyahoga County now where we're providing that service. Oh, I'm sorry, that's school markets. Got this backward, 38 sites. Senior markets we're taking fresh produce directly to a senior high-rise apartment building, for example. We know from the calls we get from seniors in our help center that sometimes they're homebound or they have a very hard time getting out. And there may be a food pantry in their neighborhood, but if they can't get there, that causes an access issue. And so where we find high-rise apartment buildings with a large number of seniors and a large number of low-income seniors, we'll actually take the food right to them. And then the Food is Medicine initiative that I mentioned. We are up to 11 sites in Cuyahoga County. You may have heard recently about the opening of the food pharmacy or food clinic at Metro Health. We did that together. We are supporting a food clinic at Otis Moss. And we also are working with a lot of other partners, including Neon, for example, which is a federally qualified healthcare clinic with quite a number of sites across the community. We're distributing fresh product with all of those partners and some others. And we think that work is very important. Cuyahoga County is a partner to us in many ways, and so while we are here, we need to make sure that we take the time to thank you for that. Cuyahoga County has traditionally made a very generous grant to the Hunger Network. The Hunger Network is an umbrella organization for a number of hunger programs that we also serve through the food bank. Those agencies essentially receive dollars on their account at the food bank, so they can access some of the purchased product that we buy, help cover delivery fees and things like that. 80% of the food that we distribute is free to our partner agencies, but some larger agencies really want to be able to access purchased product, for example, and so that helps them do that at a lower cost. So that's a very important grant to those sites. Armand Budish is one of our honorary co-chairs for the Harvest for Hunger campaign, which is currently underway. That's one of the largest food and funds drives in the nation, wrapping up mid-June. And Cuyahoga County employees do a wonderful food and funds drive. So I saw the bin when I walked in across the bridge, and the bin was almost full. So thanks to any of you and to every county employee who has participated in some way. Now, you know, we're working very hard to reach as many clients as we can. We're expanding our programs. We are providing more nutritious food all the time. But But the fact is that nationally, for every one meal provided by a food bank, 12 meals are provided by SNAP. And so we care deeply about the success of the SNAP program. We have one of the largest in the state and one of the largest in the nation by food bank standards, outreach team who is out in the community led by Tiffany, trying to help people apply for SNAP and for other benefits. And we want to make sure that as many people as possible have access to the benefits that they're eligible for. And so I'm going to turn it over to Tiffany, who is really our expert, to share a little bit about our outreach team and outreach efforts, and also some of the challenges we've seen with the new software system rolled out by the state in August. So thank you.
So happy Wednesday again. So glad to be here. Thank you for your time. I just want to say that organizationally within our new strategic plan, we were very intentional to understand how we could stay connected to the community with the implementation of the statewide system. And the intent for us in doing our data collection was to simply identify and understand the outcomes. What is our true worth in terms of connecting with individuals? So I just wanted to share that because some people ask us, how did we get into this space in terms of kind of serving and collecting data through the new Ohio benefit system? So as you can see, the Greater Cleveland Food Bank, we've made significant investments around making sure that our team is available to provide SNAP outreach efforts. So we currently have a team of 27 full-time staff. If you take a look at the dollar and expenses, 48% of those dollars expenses are reimbursed, but the food bank has to fundraise for the additional dollars, and we're proud to continue to be in this space. So as Kristen mentioned, we're privileged to be one of the only food banks across the country within the Feeding America network to have a call-in option where individuals can remain anonymous and give us a call to be connected to the emergency feeding supports, but also to be connected and submitted for SNAP in terms of that application process. We're also very intentional in terms of our outreach strategies. We really have been considered the feet in the street. We're at hard to reach places. We have strategic relationships with our homeless shelters, individuals that serve seniors, and also our returning citizens. So we're very proud of the work that we've done thus far. So we've been a part of the Ohio benefits conversation prior to the full implementation in 2018. We actually started to follow this space very closely in 2017, along with our sister food bank, the Akron Canton Food Bank. We wanted to understand as community assisters, what were the challenges that we look to face? How would this impact those that we serve in the community? So we, as you know, we implemented this and converted in 2018 in August, and we were able to then better understand the challenges that we face when accessing and submitting applications through the self-service portal. We recognize that a lot of the processes were developed by the state developers, and sometimes in sharing information with leaders at Jobs and Family Services, we've learned that their hands have been tied, but we want to continue to demonstrate the challenges and true experience of that within the community. Just to give you some historical perspective, there's a lot of talk still about Ohio Benefits Bank. And we were one of those organizations that took the lead or served as the trainers for at least 60 organizations, not even just within Cuyahoga County, but within our 6-county territory that we serve. And we wanted to understand, without Ohio Benefit Bank, what would happen. And generally, just to give you a little bit of process perspective, those applications were electronically submitted into Ohio Benefit Bank and then enrolled into CRISI system, and that is the workflow process in which the Jobs and Family Services case managers could draw down those applications, and that software served as a community portal. Through Ohio Benefit Bank, we had the ability to receive reporting and really a great oversight feature in terms of sharing information in terms of the work that we've done in the community. With that, we were able to help individuals understand to receive a phone call from a caseworker versus current processes where individuals are still confused about calling into that 800 number. So the fun part in terms of data. How do we know that things aren't going as expected? Between the months of August and March, we're going to review some data in terms of the experience, and we're only speaking of those cases that were served by the Greater Cleveland Food Bank. So, for example, August to March, we took a sample size data collection for all of the applications that were submitted through the self-service portal within Ohio Benefits. We understand that there's limitations within the self-service portal, and I know we've all talked about joint advocacy efforts in terms of a community portal, but we're just not there yet. So we're at about a 30% approval rate for the applications that we submitted through that timeframe. I will make mention that Feeding America, along with USDA and FNS, does some data collection. And in 2017 and 18, the statewide average for Ohio was at close to 70%. The in progress, we talked about some federal timeliness requirements. An individual, according to policy, is expected to receive an approval or denial within 30 days from the time that the application is submitted. And we're working closely with our Jobs and Family Services team to better understand how we can flag these cases and make these priority cases for individuals who have not received that determination, actually sometimes 45 to 60 days of the time that the application has been submitted via the self-service portal. We recognize the intent is to have individuals engaged through the 800 number, but as I mentioned, for many vulnerable populations, many who don't have cell phone minutes, many who may not have cell phones, and so on and so forth, or just really our seniors who don't understand a lot of this. Just talked to a senior yesterday, and she was very confused by many of the processes and language within the correspondence that she received in the mail. And if you take a look at the denials, I think it's important to understand, and we've learned a lot about the reasons that an individual can be denied in terms of SNAP, and we're focusing only on SNAP. We understand that sometimes individuals just don't follow the process. We recognize that. But for us in the team, and we've been trained by Jobs and Family Services and attend various community forum settings to truly understand how our role and how we can have better success across our county. There's a wide range of denials, and unfortunately, denials was the highest percentage of the benefits that we reviewed. So some of the reasons, and I say some because we're actually learning of the various reasons that individuals, based on our view within the self-service portal, actually receive a denial. So we know that a few months ago, there were some media attention around the incorrect address issue. Was that a system issue? Was that a county issue? And so we're glad to see that that issue has been addressed and is actually decreasing. It's very small. Actually, most recent in March, there were only 10 incorrect address cases. So great job there. In terms of income and eligibility, there's a small percent of individuals who were deemed to be income ineligible. When we've done our follow-up, a few of those were seniors, which we're not 100% sure in terms of the senior calculations and calculating their household and medical expenses were taken into account. But the good news is some folks obtained employment within that time frame. So that's excellent. We also know that individuals have to self-report their income in terms of our process, and so we understand there's sometimes discrepancies. But the no interview piece, this is the one that will fall in line in terms of the long hold times. So right now, we have a system that tells us if an individual did not complete a phone interview, or if they did, it's very simple. However, in following up with many of the individuals who were denied, they have just simply had a challenge in terms of getting through the 800 number, and I know that's no secret to those of us in this room. I know that Kevin is leading a team, and they're working really hard to restructure and be innovative to really accommodate. I also recognize the Ohio Benefits being a statewide system. In my personal, this is just Tiffany speaking, that system was built to align with smaller counties and not accommodate some of the capacity issues within metro counties like Cuyahoga County. And then there's other reasons. We've seen a few cases, and I can't go into details without the correspondence, but citizenship status, not sure what that means. But once again, we want to have a better understanding and work together to understand how we can reach those individuals. Did not complete the certification process, moved to another county. That's also one that's a slight confusion for myself, because the intent is that regardless of whatever 88 county that you reside, you would have the similar experience and be able to move across county and not have any issue within your benefit access. So are there questions? I know that's a lot of data. I'm sure there are questions, but really just wanted to share and paint a picture in terms of our internal process and our strategy to really understand how we're able to service individuals better, to ensure their access to public benefits, and in particular to SNAP, is truly an option and available to them, and be just a listening arm for those who have some frustrations, and we're able to work with the dedicated process that we've created with Cuyahoga County Jobs and Family Services for a small portion, but there's still a great voice in the community for those who are experiencing unpleasant issues in terms of accessing the 800 number.
I have a question.
Yes.
Has there been any increases in specific data, in specific districts? If so, can the info be provided to the council member? So originally, Director, you went over that we were given maps with the dots, and it's kind of grown. I just don't know if the specific districts have been updated.
That's a great question. I will see if we have a GIS mapper and who's able to develop these maps for us. I will see if there's a way to break down by district the caseload numbers available to us.
But I will tell you, one of the challenges that we've seen, and I think that the team here would maybe echo this, is that reporting out of the new system is not good. It's not robust. Is that a fair comment? Okay. And so the way that we have this data is literally client by client. You know, we are going in, we are submitting an application on behalf of the client through the client portal, since there's no longer a community assister portal. And then once we submit the application, the client's giving us permission to go back and look to see if they got the benefit. And so our team is literally going in one person at a time. So at least in our case, what I can tell you is that whereas before there was a client assister portal where we could run reports, this is all manual data. And it's one of the reasons I believe that there's not more of this data being shared statewide. You know, we're the largest application assister in the state of Ohio, and we decided that we really wanted to invest the time in understanding how this new system was working or not working. And so our team, led by Tiffany, has put in many hours to try to drill down and see what we could do better, you know, what information we should be sharing to try to make improvements. There is no way of running a report. We'd be looking on a case-by-case basis. And we have some of it, but it's the reporting is much more difficult than it's been historically.
And could you add not only, and when you have time, but also if the food banks in the various areas have increased, do we have any new ones? You know, I like to go out and see mine. So,
New sites?
yeah.
Oh, absolutely.
Okay.
Yeah. We'd be happy to have you out.
Councilwoman Brown?
Thank you, Madam Chair. I may have missed it. You identified what the numbers were for approvals prior to converting over to this new system. And I think I heard you say 70%, but I didn't catch it for the in progress and denials. Do you have those available?
Prior to conversion?
Yeah.
Oh, you know what? I will tell you that we did not collect that information in that capacity. As I mentioned, we have just some newer work with this new strategic plan, so we don't have that available. And I also recognize that as advocates, we're interested in knowing how many people actually access the benefits that they apply for. And I recognize some of the challenges the counties face is that they're concerned or required by the federal government to collect timeliness data. So there's a little difference in terms of measuring cases based upon a timeliness issue and measuring the outcome of the application submission itself.
Okay, thank you very much. And given that narrative, I'm extremely grateful for your willingness and investment in reporting back that data for us, because it is important information. And I do hope that the state will take steps to correct that, because it's important to, I think, this body in general. So thank you very much.
Thank you.
Councilman Miller?
Madam Chair, Ms. Warzoka, did I hear that 75% of statewide SNAP applications are being approved as opposed to 30% in Cuyahoga County, or did I misunderstand that?
Sure. So within a 2-year time frame, we reviewed 2017 and 2018. There's what's called a state application approval rate. and that average has been 69.8% for the past 2 years. This year, currently, we're only focusing on the applications submitted by the food bank, and in terms of the sample size, we are at approximately 30%
In Cuyahoga County.
in Cuyahoga County.
We do not have the approval rate in Cuyahoga County before the transition to the new system. We simply have the statewide approval rate. But, you know, my concern is that we've got very talented, well-trained, passionate team members on the phone and out in the community trying to help people apply. They're knowledgeable about the benefit. They're knowledgeable about eligibility. And if our folks working hand in hand with a client are only seeing a 30% approval rate average for that client, I worry, what happens to a client who doesn't have that sort of support? Now, these are all through the client service portal, because that is the tool, it's the only tool we have at this point to help people efficiently apply for benefits. But there are a lot of folks who are income eligible for this benefit who are not getting them.
There's an aspect to these statistics that has to be driving you crazy, and I'm going to ask you to comment on that. And that's that you in fact have made huge progress on the incorrect address issue. It was running over 40% of the denials in the first few months, and it's now down to a small number. But nevertheless, the percentage of approvals has barely budged. And I'm wondering why that is.
I will say, speaking with many clients who walk in and that we interface with, many are confused by the new process still, so we appreciate the forums. But our job is to help also be that communication body. It is frustrating to hear individuals who we know have done their jobs in terms of providing proof of income, even interfacing with the library system to scan those documents in. You know, we have now become really a place where individuals that we originally did not help are coming for help. And so at times, you know, we're just trying to understand what to document. We don't always want to be the bearer of bad news, but as advocates, how can we make a change, and what data do we focus on? What examples? What population? So yes, it has been frustrating, but a good frustration. With anything new, we know there are challenges. We know that we're not perfect. So for example, our data collection will change and continues to change as we A, get feedback from the community, B, we get feedback from Jobs and Family Services, but C, also get feedback from individuals within the community. For example, I did not talk about some of the differences that we've learned from the self-service portal versus the worker portal. For example, what that means, you have a client we've worked with, we've submitted an application through the self-service portal. When we go through the follow-up process with after 30 days, we attempt to understand the status that the client is in. We've learned, and actually through our dedicated process, having a caseworker on the phone, the caseworker has a completely different view and sometimes added letters on their view versus the information that ourselves as community assisters and clients can actually see. So that can be misleading. So what we've tried to address that, and we're going to continue to work with Jobs and Family Services to understand the opportunity and what permission that we have to align those cases, just a few, to understand truly removing a community sister organization like the food bank. If I'm an individual and I've gone into this self-service portal, I'm excited, and I go back in and it says no mail has been sent. That's discouraging. So I will also share that many individuals just withdraw their application verbally, and that's a problem for us as well because they're entitled to these benefits when needed. So thank you.
So
I'm sorry, could I make one point of clarification on the letter issue? Because I want to give some credit where credit is due there. So the problem that we saw early on with the incorrect addresses is that we can help a client submit an application through the client portal. But then in order to get their screening interview, their follow-up screening interview, and also to approve the benefits, they need to have that conversation with a county caseworker in the county where they live. And so what we discovered when we saw the high number of denials and we really started digging into it is that the letter that was being sent by the county to clients to let them know that they could call the 1-800 number. Here's the time and date you should call our 1-800 number so that you can, we can ask you some more questions, do the screening interview, which is a required step in the process. Those letters were going to old addresses. And so we were able to provide that data to the team here. We have been meeting on a monthly basis, and they were able to address the issue. And that is how the incorrect the number of incorrect letters has dropped. And so we have been working very closely together and appreciate that when we brought that data to the attention of the team here, they worked hard to try to figure out what the problem was.
So you mentioned something about a community portal. What do you mean by that?
So as I gave the example in terms of our prior software, Ohio Benefit Bank, that allowed for outside organizations to enroll and have a wider range in terms of the information that we could review. And it had that bridge to electronically submit applications to Chrissy's system. I recognize right now there's two options, the self-service portal within Ohio Benefits and a worker portal. There's no intermediary source that allows for partial view in terms of a widened range or in terms of address or really where a client is in their status to try to acquire their application status.
That makes it harder for you to help people, and it's a significant setback that the new system doesn't have that.
Well said, correct.
Us and hundreds of other community sister organizations throughout the state, I mean, actually maybe thousands, had been using the Ohio Benefit Bank software to help clients apply, I should say. And the fact is very few others have made the transition to the new Ohio Benefits software. And so I do think statewide, there are fewer organizations out there providing this service right now than there were previously.
So is the state talking about fixing this problem and creating a community portal?
We have had some preliminary advocacy requests, and actually we had a meeting a few months ago with leadership in Columbus to kind of talk about our experience. So more to come on that front. I will also say that we recognize that we're trying to learn from other counties and understand their experience. But in terms of a joint ask, we want to actually have the same request together to better equip you all in terms of what we're asking and the importance of that, and the same on both ends.
We made two requests to the state. One was that they develop a community sister portal. The other was that they turn off auto disenrollment until problems with the new system are figured out. So one of the features of this new system is something called auto disenrollment. So every 6 months, a client who is receiving this benefit needs to, the first 6 months, they need to send in paperwork to show that they are still income eligible, right? If the paperwork's not in at the 6-month mark, they now will be automatically disenrolled from the SNAP program. At the 12-month mark, they need to call back into that 1-800 number to do a new screening interview. If they can't get through on the line, which is a problem that's been reported to us, they will be automatically disenrolled. It's the same number. And so we did make the request of the state of Ohio that until some of these issues are worked out, that they turn off the auto disenrollment feature. We have not heard back about that request. I don't know whether or not Cuyahoga County could turn off the auto disenrollment feature until some of these bugs are worked out. I'm not sure about whether or not that'd be possible. Okay, so that request has been made to the state.
In writing.
The auto disenrollment feature is a cause for concern. You know, we requested it in a meeting with Kimberly Hall, the new head.
Do you mind following up with in writing?
We can do that. We could follow it up once in person, but we could follow up in writing. Yeah.
Any other questions?
Yes.
Councilwoman?
So, I'm the rookie here, and so I'm learning. This automatic disenrollment really discourages me. It's like we don't want to feed people in our state, and this is just food.
Right.
But it's incredibly important. So what is the average time for approval if they've got all these quirks that present problems like letters going to the wrong address?
In our experience, we've been advised to reapply individuals if it's been a certain time frame. So for us, a general rule of thumb, if the issues can't be resolved within a 2-month time frame, we actually reapply the individuals, and that can be a challenge in a longer time frame. We've also seen issues in terms of the expedited, which is an individual supposed to receive their benefit within a 7 to 10 day window when they are homeless and truly have zero income and can prove that. And I've not seen that feature accessed through the self-service portal as well, which you can understand the challenges for those very vulnerable populations there as well.
How often do you have to reapply to this program? Is this every year?
So they're now, and Kevin, I don't know if you want to clarify, because 6 months is the time frame, and if you're a senior citizen, 12 months or 24 months is the application process time frame for SNAP. Yes.
So an interim report as you follow.
Sorry, I know. I said I just wanted, since you're in the room, let's get it out there.
Kevin Gowan, JFS Administrator. The time frame for interim reports, everybody has to file an interim report every 6 months, and has to go through a renewal interview every 12 months. Or pardon me, it goes 6 and 12, and then the next year, interim report after 6, renewal after 12.
Wow, it's a lot of work. Once again, how many people in Cuyahoga County receive SNAP benefits?
How many people receive SNAP? It varies anywhere from, well, it's right around 200,000 people.
Okay. And then, Madam Chair, if you don't mind, I'd like to defer to my colleague, Councilwoman Brown, because she had some questions that got a little more complicated.
I didn't want to drag the meeting out.
I defer to the gentlewoman from Warrensville Heights.
Thank you, gentle lady. I appreciate that. So I really just wanted to ask, is there anything that prohibits someone from duplicating or replicating services? So, for example, you have pantries and mobile pantries and senior markets. Is someone who is food challenged able to access all of those resources?
This is you.
Sure. So that was the part of having such a wide range and almost 30 full-time staff. We have benefits outreach counselors that are stationed at our sites based on the amount of people that attend those organizations. If we don't have a staff person there, we have a poster that connects directly to our help center. That's actually a part of being within compliance for our emergency feeding sites. And we also have half pagers that we distribute in each bag that individuals receive at those sites in case there's not a person there.
When it comes to actually getting food at one of our partner agencies, in our opinion, from our perspective, clients should go to any agency that is open at a time that they are in need of food, and it is fine with us if they go to multiple agencies. There might, for example, usually a food pantry provides a 3-day supply of food. Well, if you're really struggling to get by, while a 3-day supply of food is helpful, you may need more food than that. And so there are clients who might go to a food pantry, but also have their children participating in one of our after-school meal programs, and we would frankly encourage that.
Okay.
We want to make sure people have access to as much nutritious food as possible.
That's excellent. Okay, thank you very much. Thank you, gentle lady.
You're welcome. I'm good.
We want to thank you both for coming out, and Kevin
Thank
for
you.
participating and getting us clear on that last statistic there. So you were shaking your head in the background. Do you want to touch a little bit on the auto disenroll? And why?
It was simply to answer the question. We do not have an option to opt out of the auto disenroll. And just to emphasize the point, previously the disenroll in a SNAP required worker intervention. And at that point, there's obviously another chance for a worker to engage the client before they take that action. That does not happen in the new system. I'm relatively certain that that's what you're referring to.
Yes,
Yeah.
that is what we're referring to.
And I just wanted you to state that on the record because the camera probably couldn't see you back there.
Gotcha.
Didn't
Okay.
get an answer to
Thank you,
that
Tom.
question. All right. Well, again, thank you guys for coming out, and feel free to sit as we continue our meeting, which will be brief.
Thank you for having us.
You're welcome. Just want to let the
Tiffany. If you would stay after.
Oh, sure, absolutely, okay.
Just want to let the committee know that Adams Board presentation will be on June 19th, Wednesday, June 19th. And I do not, I just want to share my feelings from earlier on the contracts. Just overall, my personal feeling, I've just been looking at the county has been going down this path of relinquishing funds to outside agencies for them to do things with. And some of them have been great. Some of them haven't. My only problem with that is where you get into oversight. Under HHS, there's a lot of oversight that needs to be going on with the various agencies. And so now that we're going down this spiraling path into, okay, well, we have money, taxpayer dollars, we're gonna bid out to 2 contracts and then we're gonna let them subcontract. And then my other problem.
Doing the compliance, Madam Chair? Because there are compliance requirements with federal funding. So who's doing the compliance reporting?
We were going over overtime with the last contract, so I wasn't able to really get into what their oversight is gonna be. But I will follow back up on that. And just the second point would be, for some of us that have historic county council that started out this, we painstakingly did a procurement and contracting and how we should try to make every contract fair and open and accessible to the community. And so this is just kind of like an oxymoron with us giving away money and letting other people do that process. So I'm just
You have some
letting people know
concerns.
my concerns on it, and that, you know, we spend a lot of time on procurement and contracting and getting WE and FBE, and how do people have these opportunities if every time we go around, we're letting an administration, you know, kind of open up new doors. Now, granted, they presented it well and it seemed efficient for the residents and in terms of that, but, you know, on one hand, we're making it efficient where they don't have to speak to 50 million people, but then on the other hand, we're cutting out opportunities for jobs or other agencies to be able to get a contract with the county. So I just wanted to share that. I don't know if anybody wants to respond, but that's how I feel. So just gonna monitor it.
Do we have the opportunity for additional questions with staff at our next meeting?
Okay. So anything further? Anyone else? Meeting adjourned.
Yeah.